Good evening, everyone. Happy to see you all here. We're looking forward to being able to have events face to face. We're here to talk about the digitization of Kuwait's healthcare sector. We're really excited about this. Healthcare has always been a big part of our lives, but with the pandemic, it became even more important for all of us. And this is one of the first big events put on by our healthcare focus group. And we're excited about all of you being here. First, I'd like to thank our ED, Paola, and our team in the office, Samir, Emma, Jensen, all their hard work. A special thanks to the U.S. Embassy for all their support, and another big thank you to the Ministry of Health for their time and commitment to helping us put on this event. We feel this is very important to everyone, and we're excited to get the main event started. I'd like to put out a few admin notes. Please type your questions into the chat box. We'll get to them at the end of all the session. And we ask that you keep your microphones on mute. And we have a very special chair, Dr. Fatma Al-Naja, Assistant Undersecretary for Private Medical Services Affairs at the Ministry of Health. We're honored to have her be able to be the chair of this event. And we're really looking forward to the information that's going to be put out tonight. Now, without further ado, I would like to introduce the new commercial officer at the U.S. Embassy, Mr. Eric Podzorski. Eric, the floor is yours.
Thank you so much. I want to thank the American Chamber in Kuwait. I want to thank the Ministry of Health and all of the great speakers today for coming together to discuss this critical topic of healthcare digitization. The caliber of attendees and speakers in this room shows how high priority this topic is for both Kuwait and the United States. In particular, I want to thank the Ministry of Health, without whom nothing in the healthcare space in Kuwait can get done. And I'm looking forward to having our first meeting soon. So my name is Eric Podzorski. I'm with the U.S. Commercial Service at the U.S. Embassy Kuwait. We're part of the U.S. government, and our mission is to help create growth and jobs for American companies. You can think of us as the knowledge brokers between American companies and Kuwaiti industry. We work diligently on business matchmaking, vetting companies, holding promotional events, and conducting market research. If you're an American firm, I'd be happy to have a chat to see how we can help you grow your business overseas. And if you're a Kuwaiti firm, I'm also interested in talking. I'd love to hear about what you're doing and if there's any investment opportunities in the US. My background comes from working with one of the largest EMR firms in the United States, Epic Systems. So I was working directly with clinicians to roll out software in hospitals, both in the US and in Canada. And in these instances, I could directly see the impacts that digitization has improved on health outcomes. Having a linked chart that goes across departments and even across hospitals ensures accurate patient treatment and follow-up can be done. Digitization in the US has vastly reduced cases of sepsis, a long-standing issue in ICUs and hospitals. Genetic testing has greatly improved as geneticists gain access to a library of data and tools for analysis to digitization. On the payment side, digitization has helped help hospitals improve on-time payments and reduce their delinquency, improving their bottom lines and giving patients convenient options to pay for services from their home or on the phone, as well as vastly reducing the amount of paperwork involved with insurance reimbursements and submissions. With all of the upcoming and recently completed mega projects that Kuwait has invested in, these will all require state-of-the-art technology to run smoothly and efficiently. And I think COVID was a wake-up call for the Gulf and the Kuwait to move forward with healthcare digitization. And from what I've seen so far, Kuwait is doing a good job. Progress in e-prescriptions and automated COVID scheduling and testing has yielded great benefits to the Kuwaiti people. The Dar al-Shifa hospital hospital has reached HIMSS stage 6 status, being recognized for its digital maturity. These are great foundations to build on. And the key out from here on out is to continue that push forward. The more that we can become digitized and connected, the more improved outcomes we can see for Kuwaiti citizens. And as an American business promoter, I think this is going to be a great opportunity for American businesses to be involved. And I hope that you will consider great companies like the ones in our panel to support your important work. I look forward to continuing the conversation and seeing the great progress and benefits for the Kuwaiti people. Thank you so much for having me, and I'm going to hand it back to Pete. Thanks.
Thank you, Eric. I'm as excited as you are about the way forward. It's a lot going on. Now, I'd like to give the floor to Dr. Fatma Al-Nasir. Thank you for taking the time to be here, Dr. Fatma.
The pleasure is mine. Good evening, everyone. I'm Dr. Fatma Al-Nasir, and it's my pleasure to be representing MOH with my team today in this meeting. First, I'd like to thank you, Mr. Pete Swift, Chairman of the board ABCK-AmCham in Kuwait, for providing this opportunity for us to get in touch with all those expertise in the field of digitalization of services. And I'd also like to thank Sir Eric for his remarks and briefing from the US Embassy. Well, let me start by saying that there's no doubt that digitalization of any healthcare system has a profound impact on both clinical, operational, functional, even financials, outcomes of all the services and all the scopes. And that there's also no other area actually in the healthcare system that can offer so much potentials for increasing the process efficiency, for improving the medical health quality, for improving the patient safety, for improving the finally improving even the economic success, as the digitalization can do. And believing in all that, we in MOH have already started implementing, as you have stated, some of the digitalized processes which have proven of a great help and success, especially in the early days of the pandemic and thereafter. And for example, I'd like to just point out to some of the systems that we have already implemented, like the COVID system, which Mr. Eric have greatly thankfully mentioned, also the immunization system. Some applications were also introduced, like immune application, like Q8 Saha application, and more coming on the way. And our aim in MOH is to expand the services and the digitalization of services. And actually, as we speak now, the ministry is working on finalizing the e-prescription tender, which will inshallah soon will be seeing the light. So yes, we are very happy to be today with you in this meeting. We really need this as much as you do. And we hope we all do make the best of it, inshallah. So thank you all.
Thank you, Dr. Al-Nasir. I'm so excited. I can't wait to get started. But this is wonderful to have so many great minds together. Our expert speakers are coming from Cisco, Beatrice, Dell Technologies, and our chair of our healthcare focus group will take over from here. Tamer Al-Salab, he's the head of our Gulf and Levant cluster at Beatrice. So Tamer, the floor is yours.
Okay, so I was just saying thank you to Pete and AmCham, Kuwait, Eric and US Embassy, Dr. Fatma Al-Nasir from the MOH. Thank you for being with us and welcome everyone. I'm Tamer Al-Salab. I'm the head of Gulf and Levant cluster at Beatrice. Beatrice is a multinational healthcare company that is headquartered in the US that was formed after the combination of Mylan and Upjohn, a legacy division of Pfizer, with an overarching purpose to create a new healthcare company whose mission is to empower people worldwide to live healthier at every stage of their life. I'm also honored, as Pete mentioned, to be the chair of the recently formed healthcare focus group with AmCham Kuwait that had a mission to reinforce private healthcare sector contribution to the business landscape and also empower public-private partnership and support digitalization of healthcare systems in Kuwait. With that said, I am pleased to introduce our first speaker for today, Dr. Gabriel Jipa, Regional Commercial Information Technology Lead and Commercial Development in Emerging Markets at Beatrice, who will talk to us today about healthcare digitalization strategy and innovation. To you, Gabriel.
Thank you very much, Tamer. And first of all, I would like to thank you for the opportunity to be virtually in your front and discuss about this important topic. Some words about myself. I was joining Pfizer and then Viatris a few years ago. Before that, I was part of Compaq HP and then IBM Cognitive Solutions team, supporting large transformational projects or digital transformational initiatives. I think we can advance for the next slide, please. So why talk about the digital strategy and innovation in healthcare? I think we all know that COVID-19 accelerated the adoption of various tactics and put stress test on the ability and capability of stakeholders to execute in a very short time initiatives in the digital space. But sometimes we need to ask where we could start. How should we continue in this journey for digital transformation? Maybe how to make the system interconnected and flexible and aligned with our processes that might be partially or fully augmented by digital technologies. Not only what are the risks or the ethical concerns of introducing digital or generating data digital, but also how can we support or optimize the cost of innovation? And if we move to the next slide, please. In many cases, I see the digital strategy like having a picture, understanding the big picture of where we want to go. It's like having the cover of a puzzle and then struggling to understand what is the optimal way or what should be the order of filling in that puzzle, like navigating in a maze. In some of the cases, if we don't have the big picture defined, creating a puzzle without having the cover front page in mind, it's a very difficult and challenging task. Just imagine that you need to start looking on various strategies to test or understand what the big picture should look like. If we move to the next slide, please, we will see that part of the strategy is to understand how we link the value towards the strategy, the tactics, and then after how we make it operational. If you click on next, please, you will see that setting the goals and understanding the value that needs to be generated by our strategy, it's a key or critical success factor for the transformation. If you can press click or next on the slide. So goals and target stage definition is a critical one because it shows us what we want to achieve and informs how to create a strategy and link it to our tangible measurements or the macroeconomic factors that needs to be taken into account. It could be value-based healthcare, it could be part of the cost optimization or efficiency, or introducing new models for healthcare or new partnerships to support new partnerships. Also, it could be part of understanding how real-world data that can be generated can support real-world evidence generation. But this is a critical dependency on the ecosystem existing in the country because it has to have all the relevant or key stakeholders buy in. If we set the goals and the target state definition, part of the strategy is to understand the big pictures and the major capabilities or tactics that needs to support our goal to success. If you remember, it's like looking on the best way to see how we can navigate to this maze in order to fill in the puzzle in the optimal state and to provide fit for purpose capabilities. And part of the definition of the strategy is to understand where we are. In many cases, it's called digital maturity assessment and should define the order of these initiatives and specific capabilities or technologies that need to support this transformation. Once strategy and the tactics are defined, the key component is to maintain and grow the leadership and talent, because only deploying services is not enough. Then the knowledge base needs to be created. Talent can support experimentation and early validation of some of the hypotheses. What we see from other initiatives is that an early validation could change or inform some changes on the strategy in order to support the specific granularity. If you look at the picture, in many cases, you understand only from a glance what is the message that needs to be communicated, or what are the major characteristics. We don't know in very, very much details like the pixels in a picture, like a machine would do all the details. So we could expect some changes or variations based on this early validation. Other tools to support the talent and leadership could include co-creation of the tactics by design thinking, trying to solve and understand the right problem with the right technology, and mapping the user journey either for the healthcare professional, either for the patient, with the right set of technologies. On the culture and governance side, an important part of this, talent process technology is their integration and their models, communication processes that needs to be supported and designed. In the same time, data is a byproduct of digital transformation, and there are specific ethical, privacy, or security guidelines that needs to be addressed, as well as their risk management. Also, data enables experimentation in area of emerging technologies, maybe to support generation through Internet of Things, or to power algorithms like machine learning, or enable artificial intelligence, augmented processes. All of this should support agility and innovation for a value-based healthcare that it's tailored for the ecosystem that is designed for. If we move to the next slide, please. We were talking about as is and to be state and how we navigate. Usually, this is done by identifying this big picture with the major functionalities or major tactics that needs to be supported. And we have some examples on this slide, either related to the ACP or provider efficiency, either related to the patient, or enabling processes and functionalities to support all the ecosystem. In order to do this assessment, the easiest way is to use scales like 1 to 5, 1 to 3, and the granularity of these scales will actually give more or less flexibility in identifying the best tactics. After identifying the to-be state, that we have an integrated picture of the strategies that needs to be followed in order to fill in this full picture. When we fill a puzzle, we don't start necessarily from left to right or from top to bottom, but we focus on what makes sense, what talks to each other, what are the components which are similar in nature and can support each other. In a similar way, based on this strategy, various tactics can be prioritized, KPIs can be assessed and established, as well as some of the dependencies like data and standards for changing the data, finding the data, or describing the data. If we move to the next slide that talks about these dependencies, the prioritization should take or can take into account either the efforts to implement it, either the priorities that are set for the specific short and medium term initiatives, as well as the value provided. That could be a good way to calibrate and change at a specific point in time the needs that might come up during this transformation. Also, might test very early on the adoption of the digitalization, what could be the changes that needs to be implemented. If we move to the next slide, please. Part of this transformation enables or requires innovation. When requires innovation, various tactics like the partnerships, the startups, or using tools like hackathons or design thinking could be a very important source of innovation, either external, either internal. Also, emerging technologies and artificial intelligence can bring new perspective to old problem and maybe suggest new solutions for the same old problem in a more optimized way. We see that in many cases, a minimum viable product is the approach needed to validate and provide the expected validation for quick experiments that could lead to operationalization of these tactics, or maybe deprioritization based on the value. If we move to the next slide, please, that talks about the challenges and opportunities of the data as part of the innovation. Data as a byproduct of digital can be used as real-world data and support real-world evidence generation and improve the value of the healthcare. But having the data does not mean that we have the answer, is a common quote in the analytics space, because the data needs specific tools, methodologies, and governance in order to make it work in a secure and governed way. It needs to be able to be exchanged, to be found, to support generation of the insights and harness the full power of the data for the digital transformation. That also implies that when we move out of traditional statistics, but we want to implement artificial intelligence or machine learning, we need to acknowledge that there are biases that might affect the inferences or the conclusion coming out of the data. The data can be either used in a descriptive way to describe and generate insights or support tactics based on the current situation, but also could be used to predict some of the outcomes or some of the behavior. Also, data can be used to provide more personalization to our interventions or to support new models, which maybe are not present in the legacy processes or current processes. But data also has some ethical consideration of the use, and also has a need for some regulatory frameworks, because the strategy is made up of contribution between multiple players and stakeholders in the healthcare ecosystem. We see specific initiatives on this regulation of AI and machine learning in United States with FDA, and I added a link for future reference, or with the Europe Medicine Agency, that tries to understand how this data can be described in common language, how this data can be found using a common taxonomy or vocabulary, and not only that, how we can make sure that regulatory frameworks and use of advanced algorithms can be done in a safe and ethical way. If we move to the next slide, please. I think a digital strategy is not a goal by itself, but is a value creation enabler that needs to be tied to the outcomes that are expected. It should support innovation in a transparent way, and maybe support personalized intervention or personalized tactics for the benefit of the healthcare ecosystem. I think that was the message that I wanted to convey during this presentation, and thank you very much for the opportunity to share these thoughts with you here tonight. Thank you.
Thanks so much.
Thank you very much, Gabriel. So now, Tamer.
So thank you, Gabriel. It's enriching to learn a structured approach to digitalization and innovation that is meant to create value. The next talk will be a very relevant one on digitalization of the patient journey and clinical efficiency, brought to us by Rabia Saad, Senior Engineering Manager, GCC from Cisco Systems. Welcome, Rabia.
Thank you, Tamer. Thanks, everyone. I'm really honored to be part of this focus group today and to talk about what Cisco is doing to actually build bridges to the future of care. Next slide, please. if you don't mind. Yeah, one more. So just to look at basically the last 2 years, we understand that they have challenged us all globally as a society, and we had to reimagine and rethink the way we socialize, learn, live. And at time we all felt a big burden from the pandemic, but perhaps the most significant burden is the one placed on healthcare providers and frontline workers, as they had to step up while all the numbers were rising around the globe, and they had to quickly pivot and provide care for those who are in most need. And while we were forced to stay at home, these providers adapted and found new ways of reaching patients virtually like never before. And today, as we continue to address the impact of the pandemic, healthcare providers are actually embracing the future of care and working to provide the best and most inclusive care experience for patients. So now, and more than ever before, we believe that technology can be used to provide an opportunity for all, make a meaningful impact, and bring about a future that is better and brighter than today. So Cisco is all in on healthcare, and we are committed to best supporting you. And as we all reimagine the future of care. Next slide, please. Now, I think the healthcare industry had its own challenges before the pandemic, but as the pandemic hit, there were new challenges that emerged. Business resiliency plans were tested, ICU teams were overwhelmed. Telehealth was a critical capability that we never probably used before, but was necessary to keep hospital and clinic doors open. Patients started actually visiting with a call or a click or a chat instead of a drive. Next slide, please. Now, before we drill down into the solutions, let me just take you through a few statistics, just that we're seeing globally. Around 83% of patients had virtual care visits for the first time in 2020. Yet only 20% of those downloaded a virtual care application in advance of needing it. So the pandemic has definitely served as a catalyst of change in the healthcare experience. Consumers are more than before aware of and engaged actually to manage their health. They are driving and accelerating the pace of change in healthcare. And healthcare providers in 2020 all shifted to telehealth to be able to continue to provide care. But while the adoption of healthcare expanded exponentially, some patients are still finding it difficult to manage applications and join telehealth, etc. So there's a lot that can be done in that aspect. Talking about telehealth and telemedicine in general, we're estimating the market to be around 300 billion by 2028. So telemedicine is actually certainly there to stay. It's now about healthcare organization. If they want to look for the future, they need to consider the long-term solutions and tools to make telehealth a viable part of their business. Now, before COVID-19 pandemic, many countries faced a lot of shortage in the skilled healthcare worker, and that was estimated to be around 18 million globally. Now, what the pandemic brought in was more around the extreme burnout on these workers. So the pandemic has highlighted the gaps between the demand and supply for healthcare workers, and has crystallized the need to use digital technologies to close the gap and improve the clinician workflows and experiences. Now, another interesting stat is around the average cost of a data breach in healthcare, which is estimated to be around 7 million. And as the number of attacks in healthcare continue to increase, along with the sophistication of threats, providers really must find the best way to tackle these challenges. Next slide, please. Now, if we look at maybe the top healthcare challenges, just to summarize them. So the shift of virtual care has created a digital divide and lack of digital health literacy, highlighting inequities in socioeconomic status, race, and age. So now, for example, internet access is really necessary, even for healthcare, not only for education. And a lot of development needs to happen and for people to use healthcare and over the internet. So it is the responsibility of healthcare organizations, public health organizations, and technology companies like us to help close the digital divide in healthcare and provide equitable and inclusive access to care for all. Now, the opportunities would lie probably or include the digital front door to help target and care for specific population, and as well as virtual care to bring care to areas that needed it the most. Now, as healthcare organizations become increasingly more connected, the threat landscape becomes more complex. We talked about the cost or the average cost of the data breach, which is around 7 million. But what's more interesting, that unfortunately, healthcare has the highest average time to identify and contain a breach, which goes up to more than 330 days. So there's a lot of work that needs to be done to deploy basically automated security programs in the healthcare industry. Now, going back to the frontline workers, they are struggling mainly of burnout as a result of inefficiencies in their daily work. And more than 40% report burnout in the couple of years, last years. So it has never been more critical for healthcare organizations to invest in technologies that help streamline and optimize the clinician experience, making better use of skilled workers available and ensuring healthcare workers don't leave the field. And last is the healthcare organizations must really adapt to a workforce, must adapt their workforce to accommodate a hybrid workplace to increase, with an increased focus on technology-enabled care. Like in the couple of years, we saw a lot of, for example, ways of agile working to include, which included using remote clinical and non-clinical staff to augment and to address the capacity demands. So really healthcare organizations really need to look at how on creating hybrid workplaces as well in the future. Next slide, please. Now, so together with our partners, Cisco is basically focusing on two tracks. And if you don't mind, please, let's build the whole slide. Thank you. So we're looking at first the patient experience, but also the clinician experience. So it's about the patient journey and the clinician journey. And for the patient experience, we're looking mainly at streamlining patient communication, appointment scheduling, and outreach, enabling mobile check-in and wayfinding, and powering a network for connectivity that is foundational for the digital health experience. We're looking at also enabling care team communication and bringing specialists remotely regardless of the physical location. And we're even powering telehealth and care at home and simplifying follow-up appointments. So if you look at, for example, the patient journey here with Jordan, we really look at the pre-visit, visit, and follow-up, looking at, for example, new ways for a digital front door with chat and AI, whether it's SMS, WhatsApp, or any kind of social networking or social messaging platform to help with bookings and even rescheduling of bookings. As well as, for example, easy check-ins at the hospital, wayfinding and navigation through the whole experience at the hospital, going through the tests, queuing, even the expected time to queue for a certain, let's say, visit or a certain test, dispensing drugs, payment, digital payment as well, or mobile payment, and so on. And during the whole time, it's actually all about the patient experience for them to have the best experience while connected and relaxed. and also offer during the visit the chance to bring in remote experts for a specific requirement, and also after the visit, making sure that it's a lot easier for us to have the follow-up appointments, and those could be either digitally or virtually or physically. Next slide, please. Now, as the next slide builds also, we're also focusing on transforming the clinician experience, definitely before the visit, during the visit, and after the visit. Now, as we look at the streamlining of patient communication and with the appointment scheduling, definitely there will be fewer missed appointments. The data will be available, all the data consolidated and available on the clinicians' devices. We're trying to simplify and making sure that one device has access to all the data, as well as the inter-department communication, whether it is video communication or messaging. Clinicians can pull remote experts as well to help with certain cases, as well as enabling the asset location and accessibility to equipment, whether it is the ECG, let's say machines, or any type of machine to easily locate staff, locate assets, and save time. And definitely a better density or schedule density now that we're offering as well the virtual or the remote telehealth consultation. Even doctors can attend to those calls that usually are after hours through their system and schedule digital encounters in a better way. Next slide, please. So, I mean, the focus from our side is around building a secure, intelligent platform for the digital healthcare, and to provide contextual data to users securely, definitely, to users on any device, on any network, to any application. Now, if you don't mind, let's click to the next slide. Now, I mean, this would probably summarize the whole Cisco strategy around the healthcare, so which focuses on the innovation across the continuum of care. And that continuum of care begins from the first patient contact all the way through to a successful outcome. And it takes place both within the four walls or outside the four walls of healthcare facility. Now, if you want to look at all our solutions, they probably can be classified in four major themes. The first theme is around operational transformation. The second is around security, privacy, and compliance. The third is around patient care anywhere. And the fourth is around data-driven clinical workflows. Now, I will quickly go through some of these use cases, which are basically deployed in a lot of our partners in the region and outside the region. So if you don't mind, let's click to the next slide. So we start with operational transformation. And if we click to the next slide, we can talk about basically two use cases. One is around providing the secure, agile network for healthcare, which brings connectivity of wired, wireless devices and access to all the available applications within the hospital. The second is around the smart hospitals, and it's more around enabling the IT and OT integration, whether it is smart rooms or even robotic processes, self-service check-ins, and so on. To actually also, and we can even talk about efficiencies in reducing, for example, carbon footprint or enhancing the overall environmental usage within the hospital once we have access to all these data. Next slide, please. Yes. So the other two use cases, one is around the hybrid workforce, and it's mainly around better collaboration within the healthcare workers, whether it is between the doctor, patient, nurse, or even the remote specialists, and bringing remote specialists. And there's a lot of efficiencies that we can use there or benefit from there. Now, the fourth use case is, and we've seen this a lot within the pandemic, is around alternate care sites and mobile clinic, where we've seen, for example, test sites or even vaccination sites that needed to be brought up in support for all the COVID pandemic, and having access to all the data, or bringing access to all the data and access to all the applications and the healthcare applications. Next slide, please. Now, the second pillar or theme is around the security, privacy, and compliance. And if we look at some of the use cases in the next slide, and these are focused around the medical device and IoT security. As we said, like, it's very critical for us to focus on all the security for IT, OT, the segregation and the segmentation of the networks between the actual clinical network, the IT infrastructure, as well as the OT environmental sensors, for example, cybersecurity for healthcare across the whole continuum of attack, and even extending that to the cloud and the workforce protection at home. And definitely the third use case is around the video surveillance and physical security. And on top of that, all the analytics that you can get from the video surveillance as well, that can serve into enhancing the business processes. The next topic is around the patient care anywhere. And some of the use cases I think we talked about during the flow, talking about the patient journey. So one is around the digital front door, and it's about actually a more proactive engagement with the patient, and the choice for them to get the healthcare services either virtually or in person, and follow all and make it a lot easier for them for check-in and getting all their details. The second use case is definitely around telehealth and virtual care, whether it is even to augment the network of a certain provider and bring in different doctors from different clinics, or even bring them remotely from home, or experts even from outside the country. The next use case is around remote observation services, and this is definitely to enhance or optimize the time and the numbers of workforce needed, and we can extend that to some of the use cases about remote observation at home, and tracking or maintaining the connection with the chronic patients at home. And last one is around the mobile experiences. We talked about the experience of a patient within the hospital, from check-in to Wi-Fi access, but also to location-based services, guidance, wayfinding, and even all what we talked about around, let's say, queuing, an estimated time needed within the hospital and each step, which makes it a lot better in terms of experience for a patient. Now, the fourth pillar, if you want, is around the data clinical workflows. And here we have few use cases, definitely one around the hybrid cloud platform for the clinical applications, with all the full observability to relate the business requirements with the technology performance of applications and network. The other one is around the clinical communication and collaboration, and we talked about that as well, extending the workforce, as well as streamlining the communication between the different departments. And the last two use cases are basically around medical device integration and artificial intelligence, and this basically helps in collecting all the data from the medical devices and analyzing them and presenting the best suggested outcomes to doctors to make the best decisions possible. And the last one is around location services for the clinical assets. It is whether to locate patients, locate staff, locate doctors, and also locate assets within the hospital, and definitely improve the utilization of assets across the hospital. So that was just a quick snapshot of what we're doing today with the different healthcare providers. And thank you for the opportunity, and we're happy to extend more details if needed through other interactions as well. Thank you.
Thank you, Rabia, for a very interesting talk and use cases. Our next speaker is Russell May, Healthcare Field Director from Dell Technologies, who will be addressing the crucial topic of cybersecurity in healthcare sector and healthcare information and management system society standards. Welcome, Russell.
Thank you very much, Peter. It's a great honor to be invited to speak today by AmCham, the Healthcare Roundtable, and so thank you very much. And it's also a great honor that you're spending the next 10 minutes with me while we speak about cyber resilience and a standard-based approach to delivering healthcare digitization. So these are two very important areas for me as a technologist working in healthcare. We see the attack surface in healthcare growing with the increase in healthcare data over the last couple of years. And also we need to look at a pan-ecosystem approach to digitizing the healthcare environment in a way that's logical and makes sense to providers on the ground. So if we just go to the next slide, I'll just introduce myself a bit more. My name is Russell Main. I'm the Healthcare Director for the Middle East, Russia, Africa, and Turkey. Unlike Eric, who spent some time at Epic, I spent 7 years at Cerner, and I've been in the Middle East for the last 10 years. In addition, I spent time working in the National Health Service, and I'm a clinician by background. I'm a physiotherapist and studied at University of Cape Town, South Africa, and received an MSc in pain science from University College London. And I'm also the Middle East Cloud Alliance healthcare lead for the region. I'm now working at Dell Technologies. Thank you. So the reason why I'm, as a clinician, I'm so passionate about technology is really I see it as being something that can really have a large impact worldwide in terms of population health. And that passion is really echoed by Michael Dell. And he has an ambition to really transform the lives of 1 billion people. And if you've read his recent autobiography, Play Nice But Win, you'll recognize that he comes from a healthcare background. And healthcare is really one area where technology can have an enormous impact. But with that impact comes a danger. And we've spoken about the attack surface in healthcare and the increase in bad actors working in cyber. And so if we go to the next slide, we can see that what's happening is that there's a massive exponential increase in patient data growth. Before, when the medical record was mainly on paper and highly undigitized, it was extremely illiquid and it wasn't able to be moved around very easily. But what we've seen over the last couple of years is a massive digitization of that record, and with that, an increase in data size. We've also got an aging population and people that are staying inside the medical record for longer, so their data footprint, as it were, is increasing. In fact, if you look at DICOM images and tumor RNA and DNA samples and whole body images, they start to take up a lot of space. And so with that, we see an increase in the actual physical data attack surface that's available to cyber criminals. If we just go to the next slide as well, what we've also seen when we speak to all our clients, and we have over 100 healthcare clients across the MERAT region, and as Dell Technologies in the healthcare space, we have over 300 people dedicated 100% to healthcare clients across the organization. And what we're seeing is that there's a massive increase in the cyber threat that is bearing itself down on healthcare. And the research bears this out. You know, we've heard of a value of $7 million to recover from a cyber threat, and that's 6.5 million in the Middle East, just second to the US, which is the highest globally. We've seen a massive increase in phishing attacks, 600% phishing attacks between February and June of 2020, and over 2.5 million phishing attacks in the Middle East between April and June 2020 alone. That's sort of over a 3-month period. And talking about that exponential growth in patient data, we've seen that every 73 days, the amount of medical data is doubling. And that's phenomenal. That means that you need to be very organized in being able to manage that, that cyber threat. Can we go to the next slide, please? So what we're seeing is that our clients in the region are really looking to use modernized technology, have a connected workforce, start to get involved more in virtual health, and then aspire towards personalized health. But all of this needs to be on the foundation of secure care. And by that, I mean a cyber resilient and cyber secure strategy going through. That needs to be foundational in any technology that gets developed and put through in healthcare. Because without that cyber resilience, organizations are putting themselves at risk. And what we know is that the impact of that is phenomenal. Not only is there a financial impact, which we've spoken to before, but there's an operational impact by being held ransom with ransomware. There's also a organizational impact. And then finally, and probably most important to me as a clinician, there's a clinical impact as well. These systems are designed to be up 100% of the time. And for any reason, if they go down, especially because of a cyber threat, it can be a really poor outcome for the patient at the end of the day. So once we've established that there needs to be a fundamental focus on cyber resilience right across the ecosystem, we need to think about how we can digitize that ecosystem. And really, there are 2 ways that organizations, that government and ministries can go. The one is to take a very laissez-faire attitude and just allow everyone to do whatever they want, use any system they want, and slowly develop. And that's one approach that can be taken. The other is to centralize that very much and to dictate and be slightly more autocratic in terms of what systems need to be deployed. A good middle ground, I feel, is to really digitize with intent and focus and use an international standard to be able to drive digitization across your ecosystem. So the Health Information Management and Systems Society, HIMSS, has standards that are internationally recognized that support organizations in that digitization. They focus on governance and workforce initially, and then on that is built your interoperability standards. And the key about this is that not only are they interoperable, they're cyber resilient, they're patient focused, they allow for nationally reported quality metrics to be pulled to central databases. They aspire towards zero harm care, and we'll speak about that a bit more when we speak about the Institute for Healthcare Improvement. And they allow for regulatory clarity. It also allows for joined up policy, and importantly, there's protection of sovereign health data. Can we have the next slide, please? So I saw that there was a question around cloud and medical data. Our view at Dell Technologies is that we need to look at data first, and medical data needs to be secure and sovereign, and there needs to be a clear policy regarding health IT strategies. And the data, if data is going to be allowed to be stored out of country, it needs to be clearly defined exactly what type of data that is. And the more regulatory clarity that can be developed for a healthcare ecosystem, the better it is. The problem is when providers are trying to work in a regulatory vacuum. Once that regulatory guidance is clear, we need to develop a robust healthcare IT infrastructure to empower all those systems to work in an interoperable way and grow and scale as we go through. And this allows for the patient record to become accessible. It becomes liquid across the ecosystem. There's no point in digitizing your record but then at the same time, not having an interoperable patient data. So that just means that although you've digitized, it's still sitting with the provider and not able to be moved easily for patient benefit. Finally, I want to speak about the Institute for Healthcare Improvement. So next slide, please. So the Institute for Healthcare Improvement has recently developed on their triple aim and then quadruple aim, and they now have the quintuple aim for improving healthcare. And this is that every technology in healthcare needs to be looked through this lens. And the quintuple aim is that you should be improving population health. You need to be focused on reducing cost, enhancing the care experience for the patient, reducing burnout, and we've spoken a bit before about the impact of clinicians through the pandemic, and then advancing equity. This is important as we start to develop AI solutions. And in fact, there's been a recent paper on bias that's inherent within AI and making sure that we're taking steps to prevent that bias. So I think that if I just summarize some main points, I think over the last little while, I think we need very clear regulations around the requirements to ensure where data is held and also around cybersecurity. And it should be an expectation that chief executives and chief information officers retain a secure environment for sovereign healthcare data. This means that we need to have joined up policy, potentially between the telecommunications agencies, the Ministry of Information, and also the Ministry of Health. Cybersecurity is absolutely fundamental, and everything needs to be built on that foundation of cybersecurity. We need to focus on interoperability of healthcare, and we can use international standards to drive digitization as a way to move everyone in the same direction without being draconian as to what they're required to do. And through all of this, we need to maintain a patient focus. So I just want to thank you for your last 10 minutes. It's been really interesting and hearing from the other speakers, and thank you again for the invite to present.
Thank you so much, Russell, and thank you so much to all of these speakers. So now we're going to move on to the Q&A for the three presentations. So if you guys have any questions, please do type them on the chat. So we'll start with the first one. So the partnerships that we have seen throughout COVID show us that private and public sector must work together in order to execute innovative ideas, especially on digitization. We saw it with the Cleveland Clinic in the UAE, especially with the digitization of the patient journey. This question goes for any of the speakers. Do you feel that the inpatient journey in Kuwait will be digitized in hospitals soon? And what would be some of your recommendations to start on the ease of the patient journey?
Yeah, so I'm happy to take that. So yes, I agree. I think that the inpatient journey is going to be digitized, not just in Kuwait, but globally. We're going to see a complete digitization of the entire inpatient journey. Exactly how that happens can be standards driven, because I don't think we should be looking to dictate one technology over another. I think that we should allow healthcare providers that are close to the patient to be able to define exactly what technology is going to be the best fit for them. But there needs to be an impetus given to digitize. It's not going to happen independently. And that's where the ministry and regulatory authorities can support organizations to push them forward to digitize. For example, if you look at a health information exchange, sometimes those health information exchanges are central, and they make a mandate that there's an expectation that organizations digitize and connect to the health information exchange. And if they don't do that, they should expect that their license to practice will be revoked. That kind of hard approach isn't completely ineffective to support digitization across an ecosystem. Thank you.
Thank you so much, Russell. And then we have another question. Is Kuwait ready for a major medical culture shift in which physicians are held accountable for utilization and outcomes? Okay.
Hello. Yes.
If I may take that question, please. Physicians in Ministry of Health have always been accountable for utilization and outcomes, and especially after the publishing of the latest law regulating all practices of medical care. It was published in 2020, October 2020, and that law frankly states all the accountability of all the physicians, all the details that they will be holding accountable for. And it has always been this way since before using the digitalization, and it will always continue to be that way because we're overruled by the same ethical applications of that practices law.
Thank you so much, Dr. Fatma. So when it comes to healthcare, the human element seems to be an integral part. Does digitalized healthcare impose loss of human element or touch? Cisco or Beatrice, if you would like to answer this question.
Yeah, I can. Yeah, go ahead.
So maybe I can shorten my answer to allow me also to touch this point. I guess the chance to lose the personal touch is limited to the way that this technology is deployed and adopted. We know that adoption of a specific technology is based on ease of use and perceived value that this technology is giving us. It's not merely a replacement of everything human, but in most of the cases, we see value coming from a digital when specific parts of a process or a service is augmented by the digital or is replacing some processes or some activities which are lengthy or may be needed in a shorter time. So I don't think that it will lose the touch of the human because I guess we are not aiming for a full digitalization and replacement of the human element in the digital or in the interventions by them. Thank you.
May I have a question, please?
Yes, please go ahead.
Yes, my name is Riyad Al-Kazmi. I'm not a doctor, I'm an engineer, but what I'm observing, I'm a Kuwaiti and I'm proud to be a Kuwaiti. What I advise you, if those associations, let me I call it, which they can give the service where they can link all the files of the patients to be in touch to the doctor from any location. This is what I think I want to, if you can suggest to Ministry of Health, this is what I mean, so the doctor can have an access to any type and to make some control on in the prescription of the medicine to the patient. Thank you. I hope my raised question is clear. Thank you.
Thank you so much, Mr. Riyad. So the centralization of patient healthcare records being available throughout hospitals, correct? Engineer Ahmed, if you'd like to respond.
Yes, hello and welcome everybody, and thank you for this beautiful presentation from people from Cisco and Dell. As people from Dell talk, that health exchange information is it's an urgent, it's a must, and this is our aim and this is our strategy and policy that coming up for the next fiscal years. That's what we need to do in Kuwait because we have so many different partitions. HIS been implementing, LIS, different ones, and etc. So this is our aim. We are working on this. This is our target. That's what we're going to do. As Dr. Fatma mentioned right from the beginning, the e-prescription is going to be seen live soon, hopefully. with the next few months coming. And so we are proceeding and going on with digitalizing the Ministry of Health. There is a culture action here. There is privacy of patient. There is a sensitive data. Like one of these questions, are we allowed to go in a public cloud outside Kuwait? We are not allowed. We are very sensitive about this information. It's need regulators and law to come from top high government and the parliament. So health information exchange must be implemented in Kuwait, and that's what we are, as of IT, working on this with all partnership from IT providers in Kuwait. Thank you.
Thank you so much, Engineer. We appreciate the Ministry of Health's input and feedback on this. So one last question. So integration is a core layer to have all these solutions, technologies integrated or synchronized. What is the best solution and why?
I'm happy to take that. So I think that the key here is that there isn't a one-size-fits-all best solution for interoperability of healthcare data. Healthcare data is very bespoke in many ways. What is important is that there's a standard that is aimed for where the data is interoperable. And then once you have data that is liquid and interoperable, then that data can be moved across a healthcare system. It's not a specific solution that is required, but it's an expectation that the data that's being delivered inside those solutions is going to be liquid and interoperable for other providers.
Thank you so much, Russell. Gabriel or Rabi, would you like to add anything onto it?
Maybe to comment a bit on the format of data. Indeed, the standards of data are critical in order to allow data to speak to each other in a simplistic way. But I guess that the architecture that supports the digital transformation needs to be aligned with agility and flexibility in mind for the design. Probably microservices or other type of approaches allows an organic growth of this digital ecosystem that needs to support the tactics, as well as will allow reusability in deploying or enhancing specific applications or functionalities which are already deployed. In simple, having this type of approach like microservices or having a transparent way of these applications or systems to communicate to each other, regardless of how the data is stored physically on the backend, could really improve the interoperability and offer flexibility for operational and change management.
Thank you very much. Rabi?
I mean, I think the gentleman mentioned all the points. I mean, the most critical point is to have open systems with clear APIs to integrate. So, and that's the approach that Cisco has taken throughout the whole platform, from the network, the security, the infrastructure, as well as the application layer and all the full stack visibility that we do. So it's more about openness of the system to be able to integrate with any type of other systems that we have. And then it becomes kind of normalization for this data to be able to connect and exchange the information. Now, I've seen also a couple of questions in the chat asking maybe about how to target to have contextualized data while we lack digitization of some workflows and processes. And I mean, this is definitely needed for us to deliver contextualized data. So what we're trying to do is digitalize all the touch points within the patient journey or within the clinician journey. And this means that at every single point, whatever application you're interacting with or whatever system you're interacting with needs to be digitalized, connected, and so that you can have access to all this data and create contextualized information to make decisions based on it. So I mean, we're definitely not there yet. We started to digitalize few of these touch points along the way, but we definitely can have some contextual data today to be delivered in some of these touch points, but not across all the patient journey, definitely.
Thank you so much, Ravi.
And can I just respond to Fadi's question as well, because he had a question about decentralized data silos, right? So I think it's the answer to that question is that cybersecurity isn't necessarily in one area, maybe just on the server stack, right? It's right from the core to the edge to the cloud, right across the whole ecosystem. And it's right from the core infrastructure, the tin and racks in terms of the servers and the storage, and then it ends right on the other side in terms of the actual end user devices. But it doesn't even end there in terms of, that's maybe where it ends from the hardware perspective, but cybersecurity even goes further into the human component and helping people to be more aware of potential phishing attacks, being aware of attacks that are being made on their system as well. So I don't think, although there's a technical answer to your specific question, I think it's important to recognize that true cyber resilience and cybersecurity isn't about just supporting one aspect of that care. It's around really understanding the entire continuity of that health data and making sure that it is protected and secure all the way through that whole pathway.
Thank you so much, Russell. And I appreciate everyone's comments and feedback, and thank you everyone for your questions. So now I would like to hand it over to Dr. Fatma.
Yes, thank you everybody for the beautiful presentation. It was very enriching and very enlightening. I just like to say that a strategy has always to be a holistic approach. And I know we're just touching the tip of the iceberg. There's a lot of things to be dealt with. One more added information I would like to add is like just adding to what my colleague Muhandis Engineer Ahmed Al-Gharib has added. We do have some struggle getting the agreements for our information to be outside on the cloud. We have tried that during the pandemic, and then we met with a committee made up of the Central Agency for Information Technology, and also it was made up of the Supreme Counselor of Ministers, and also CITRA, which is Communication of Information Technology Regulatory Authority in the country. And at first, they have shown a bit of objection for us to go forward with that information being put out cloud. But we do believe that this refusal is not permanent, and that MOH is really eager, because this is the future and this is where we're all heading. So it could be an obstacle in the past, but I do believe that in the future, a lot of things are bound to change. And I'm really looking forward for more cooperation and further meetings discussing these further issues. Thank you very much all.
Thank you so much, Dr. Fatma. Now back to you, Tamer.
Thank you, Paula, and thank you, everyone. Let me close by saying that globally, COVID has shed the light on the importance of digitalization in healthcare systems and how this can impact the patient experience and outcomes. Today in our presentation, we have seen that a lot of examples that was proving this point of view and how digitalization can really support patient and healthcare globally and in Kuwait. Once again, I would like to thank the Ministry of Health in Kuwait for their support to organize this meeting, Dr. Fatma Najjar, the US Embassy and AmCham Kuwait for their support. Thanks to our esteemed speakers and all our audience. I wish you found the meeting today of value. Enjoy the rest of your evening. Thank you so much.
Thank you, everybody.
Thanks, everyone.